Today, let's talk about accountability. Have you ever had a patient who doesn't want to take responsibility for their actions? I know I have. Let's talk about John, who came to my office last week. John comes in, his aligners are obviously not fitting. Everybody in my office, my staff and I, it's clear to us that the patient's not been compliant. But when we look at John, John says, "I wear my aligners all the time." That can be very frustrating. And not only can it be frustrating for the doctor and patient, it also wastes time and it wastes money. Imagine if you had a way to hold patients more accountable for their actions. And let's start with the definition. The definition of accountability is the condition of having to answer, explain, or justify one's actions or beliefs to another. It often includes the possibility that you will be held responsible and punished if your acts cannot be justified, or rewarded if your actions are justified. This is an article that I pulled off the web from Psychology Today, entitled "The Right Way to Hold People Accountable." And this talks about accountability in the business place, but it also applies to orthodontics. So in this article, the author identifies several issues revolving around accountability. Accountability is not simply taking the blame when something goes wrong. It's not a confession. Accountability is about delivering on a commitment. It's responsibility to an outcome, not just a set of tasks. It's taking initiative with thoughtful, strategic follow-through. Getting angry with people when they fall short is not a productive process for holding people accountable. It almost always reduces motivation and performance. And think about your own practices. Yelling at people, no one likes to get yelled at, and yelling is typically demotivating and it's not recommended.